Afternoon. I'm Eileen Doherty, and I'm the director of the Colorado Gerontological Society. And today we're going to talk a little bit about you as an older adult supporting the caregivers as you age. This is part of our advanced care planning series. Um, so we're going to start out sort of identifying who is a caregiver, who is your caregiver. And that can be any number of people. Oftentimes, we think of the caregiver as your spouse or an adult child or your children, but it can also be grandchildren, it can be great grandchildren, it could be siblings, friends, neighbors, pretty much caregivers as you need assistance and support is anyone who comes into your life and helps you with various kinds of tasks and supports. Um, and what we're going to focus on today is primarily that informal support system. It's not going to focus on that formal caregiver support system, which you would usually get from an agency. So, according to a recent study released by Johns Hopkins, approximately 24 million families are supporting older adults as of 2022. That number is projected to increase, but they didn't make any projections about how many it would increase to by 2050, which sounds a long way away, but in many instances, that's only 25 years from now. So it's not a real extended period of time. And one of our problems of our issues that is going on at this point in time in terms of family caregivers, and I do believe that this is going to get worse, is our federal policies, which then are adopted by the states in many, many instances, are really encouraging family caregiving. Whether intentionally or unintentionally, we don't necessarily know always. But at this point in time, hospitals, long term care agencies, such as nursing homes or assisted living, home care agencies, community based organizations, such as area agencies on aging, agencies that are reimbursed by Medicare and Medicaid, all of them are focusing more and more on family caregivers taking on a more extensive and increasingly skilled level of service. We see a lot of in situations or certain kinds of injections, or they would be there, if you will, to provide um, infusions. All of that kind of stuff is now oftentimes being transferred to family members. So as these state policies are happening, one of the other things that is happening is that we get how we are reimbursing the system. So at this point in time, there's a thing called value-based payments. And what value-based payments do is they look even more more different, I guess, than the diagnostic related groups and some of those types of reimbursement systems of 20 or 30 or 40 years ago. So these are now called value based systems. And what they really set up to do is that there is one reimbursement that is paid, usually if you are in a hospital, although sometimes it could also be depending on who the lead agency is. And that hospital, say, for example, gets one amount of money. If they then can discharge you state safe to home, or what they consider safe to home, with some level of support, they will frequently do that because then they don't have to share any of that amount of payment with, say, the nursing home or the home care agency. It's also why we sometimes find a reluctance on the part of hospitals to admit individuals when they revisit if the care becomes outside of the scope of what a family member can do. So they take you back to the emergency room, and then we find a reluctance on the part of the hospital to actually readmit because they basically get have to spend more of that payment on a readmission. And so it's kind of an interesting reimbursement system at this point in time, but is always shifting more and more of that care to family members. So, as you're thinking about what you as an older person might need help with as you are aging, there are a lot of tasks and supports. So oftentimes, initial ones that we find are help with paying bills, help with transportation, help getting groceries. Those kinds of things are one of the very first areas, if you will, that people frequently find themselves asking for or needing assistance. Another area, and very frequently, those services are performed by informal caregivers. They're performed by your family, your friends, whoever. This area that we frequently see people needing help with as they age and get more frail is activities of daily living. And this is things like preparing meals. This is things like needing help with bathing, not feeling safe, needing medication monitoring or support, um, needing help with incontinence issues, getting in and out of bed, transferring, not being able to be as mobile as you were once. The next area that we see caregivers really, really often stepping up is that they visit more frequently or they may phone more frequently. They'll visit several times a week. Some people even go to the nth degree of visiting almost every day. They may not stay long, but they're checking in on you. They may be checking in on you physically by walking in your house, or they may simply be looking for, is the light still on? Is the light on in a different room than it was this morning when I went to work, than when I came home from work tonight? So there's a lot of that kind of informal but also formal service that you often are the recipient of and may not necessarily be aware of or conscious of. Sometimes you are because you've asked for that kind of support, and sometimes you're not. Another task that we find people frequently taking on is managing your property. This could be things like helping with mowing the grass. This could be things like snow shoveling, could be helping with rental properties. Some people may even have a farm or need support or assistance with an investment portfolio. Um, Sometimes we also see people taking on the care of animals. So you may have a dog, but you can't walk that dog anymore. So your neighbor takes that dog for a walk, or they may take it to the vet for its annual immunizations or whatever. All of these kinds of things are often activities that we require support from our informal caregiving support system. And we may be very aware that people are doing these things for us, or we may not necessarily think about it in the same way that other people might. What you really want to avoid is becoming a burden to that individual. Once you become a burden, once you are non appreciative, then that's when that relationship often breaks down. So, we're going to talk about a little bit for the next few minutes is ways that you can support your caregiver. And oftentimes, these are not financial reimbursements. So, one of the things is think about this person, whether it's your spouse, your adult child, your adult daughter in law or son in law. Think about what they are feeling. Show empathy to them. Acknowledge their physical and emotional support. Acknowledge that they may be getting very tired, very burdened, very overwhelmed with all of the tasks and supports that they are providing for you. So try to, if you will, provide a listening ear, even if you feel like you're not maybe necessarily the best listener in the world. Listen anyway. And even if they're complaining about things that you wish they wouldn't complain about or that make you feel bad because you have to ask for their help, listen anyway and validate that you are appreciative, that you will do as many things as possible for yourself. But basically, understand that this person is giving a lot of themselves to be a support to you. Needs practical assistance. Sometimes, and I have a brother in law who's like this, do as many tasks as you possibly can. My brother in law errs on the other side of that. He is constantly yelling at my sister, and he yells. He's not a please and thank you guy. He is a guy who says, Linda, I need this. How do you think she feels? As opposed to if he would say, Linda, would you help me with this? All the very different sound in the voice and an all very different request. She's much more likely to feel okay when he asks her in a kind voice. But what's even more important is that many, many times he can get up and do it. He is just too lazy, too unmotivated. So push yourself to be as independent as you can. Do all these things for yourself because not only most times are you able to get up, go to the kitchen, get yourself a cup of coffee, make yourself a peanut butter sandwich, whatever it is, do these things yourself. Avoid being that codependent individual who just says it's easier if I have them do it. Because what happens is that you burn that person out, they become less willing to do it, and they're less likely than to really be there when you need them. Besides, if you get up and move yourself, even if it's only taking a few steps from your recliner to your kitchen, or if it's going to the back door, or if it's going over to the mailbox and picking up the mail, every one of those steps counts. And sure, at this point, as you're getting less able, you're never going to get to that goal of 10,000 steps a day. That's a goal for younger people. It's not a goal for individuals who are less able to be independent. But get up and take as many steps as you can. Even if you can take 3 or 4 or 500, that moves your blood in your legs. It avoids blood clots. It keeps you from getting so weak that you're not able to get in and out of your bed. It also can help sometimes with memory issues because now it's forcing you to get up and actually do something. Forces your memory, it forces your brain to work. Whenever you're able to do all of these kinds of things for yourself, take credit, praise yourself, say you did a good job. And, if you are in charge of yourself, then other people will be much more likely to help you. Now, being independent is a benefit, but don't be so independent that you do it to a fault. Because if you are risking yourself, say you're living too long independently in your own house, and you are a fall risk, and you've had to call 911 a number of times, then maybe that's being too independent. So, so there's a fine balance in being practical, doing things for yourself, and at the same time being such a high risk. Another thing that we want you to do with, or we suggest that you do with your caregiver, is encourage that they practice self care. Remind them to take care of their own health and well being. What we have found many, many times, and the research will support this, and it's usually the wife will spend so much time, so much energy that she does not take care of herself. And she then feels like she does not have the ability, if you will, in the moment or at this point in time to go to the doctor or to go exercise or to go take a walk, whatever it is. You need to make it okay, encourage it, and in some instances, demand that your caregiver take care of themselves. Because here's the bottom line: if they don't take care of themselves, they're not only not going to be there for you, but they're also going to be not able to live a healthy, well um, balanced life. Help your caregiver also to find ways to relax and de stress. Maybe you can do some things together. Maybe you can do some yoga. Maybe you can sing. Maybe you can listen to music together. So find things that you enjoy and do them together, so that, again, your caregiver feels engaged with you, but at the same time, that they are not in such a stressful moment. Encourage your caregivers to engage in activities that they enjoy outside of you. So, getting together with friends, trying to either find somebody who can give them time to go for coffee with a friend or go, for a walk or go to a yoga class, whatever makes sense for that individual. Also, I have seen people who are not okay. They complain, they are cranky if a caregiver finds someone else to help while they take care of themselves. Be okay with that person, even if it's a paid person, even if it costs you $100 for a 4 hour or 3 hour minimum of care, where your caregiver goes off, gets her hair cut, goes to a yoga class, goes shopping for new shoes. I don't care what they do, but be okay and spend the $100, or be okay with someone other than them stepping in to support you in the moment while they are taking care of themselves. And this last one we've really talked about already, but a really important thing is exercise. Exercise for your caregiver, that keeps them healthy and well as well. And, offer to take a daily walk, offer to get in the wheelchair, go slow on your walker. It doesn't matter. Go to the end of the block. Maybe in a week or two, you can go down to the next block. Again, getting out into the open air is also going to be beneficial to you because you will breathe the fresh air. You will be in a different situation, whether it's at the park, whether it's just in front of your house, whether you're walking around your yard. We don't care what you're doing. We just want you to move and do it. Stay connected. Another thing that happens as we age sometimes is that we lose our support network. And sometimes this happens very naturally because our colleagues pass away, or our colleagues get dementia, or our colleagues move away because they need to be closer to family and friends. But that does not mean that we have to lose contact with them. What that means is that we need to find ways to stay in contact with them, whether we're doing most phone calls, whether doing emails, visits, whatever it is we're doing, we need to find ways to do that. And do not hesitate to do things like, say, your grandson lives on the other side of town, and don't give me the excuse that your grandson is busy. Your grandson is not working 24 hours a day, 7 days a week. Your grandson can, if you invite him, come to visit you once a week, once every other week. Maybe he can only come for coffee and he stays for 30 minutes. Maybe he stops along the way and grabs a Chinese meal. Do you know how important your major caregiver will feel if the grandson comes by with a prepared meal that she doesn't have to cook? And what's even more important is that if she can go for a walk while you have lunch or dinner with your grandson, if you make those expectations, your kids and your grandkids, they will they will raise to the occasion. Your family and friends will also rise to that occasion. You need to make it okay. If your grandson doesn't have the money to pay for the meal or the coffee, offer to give him 15 or 20 bucks. You should not pay for their transportation when they come to visit. But if they've spent 30 bucks on a Chinese meal for you and them, and they don't have the money because they're just starting in a new job, or they're really young, or they're in college and they're living on ramen, offer to pay for the meal. You don't want to be that sick person, and you don't want to behave like a sick person. You want to continue to be independent and initiate communication. You don't want to wait around for people to contact you. If you wait around for people to contact you, I guarantee you, you're going to be waiting for a very long time, because most of the time they will not take the initiative. This one is really, 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 really important. Be polite and appreciative. Say please and thank you, and say it often, and say it with meaning. My niece called me a few months ago as she was struggling with her mom in a rehab center. And she described her mom as a bitch. And she said, people don't want to come in and help her because she's such a bitch. And I'm like, but that's not usually your mom. So what's going on? And she said, I don't know, but somebody needs to talk to her. And so I gave her mom a call and I said, look, you know, everybody wants to feel appreciated. Everybody wants to feel like they can help you. And in this instance, it was paid help. But get out your please and thank you. We teach toddlers, we teach 2 year olds to say please and thank you. So, why does that go out the window when you are dependent on somebody who is needing to take care of you? So, just remember it. And as I say it often. Now, if your caregiver is still employed, you may be able, or they may be able, to use something called family leave. Some of you may have heard of this, some of you may not have. There are actually two programs in Colorado that you can take advantage of. This may not be true in other states. You can always take advantage of the federal program called the Family Medical Leave Act, or FMLA. This is available to all employees, except those who are in very small companies. Like, it might not be available, I believe it's like 5 or 10 employees. But if the company has more than that, they have to offer you FMLA. And what that means is that the company has to give your caregiver time off, for, I believe I should have looked this up, but I think it's like 12 weeks, 16 weeks, something like that. It's paid time off. And the important thing is that if the individual takes this time off, then they have to be guaranteed that they get their job back when they return to work. Now, this FMLA can be taken as um, it could be taken as a week here, and then the person goes back to work for 3 weeks, and then they take it off again for a week or two. It doesn't have to all be taken consecutively. But if you apply for it, then if you are and are granted it, then and the caregiver is taking off a lot of time or what feels like a lot of time because they're leaving at 2 o'clock in the afternoon because they need to come home and prepare meals, or they only have paid caregiver support for you from 8 in the morning till 1 o'clock or something like that, and you're alone for an hour and they come home at 2, those kinds of things, then they're guaranteed that they won't lose their job. And that's the important thing. Because I very often hear of families who take the time to take care of an older adult and then lose their job because they have missed so much work. FMLA is one way to protect that. In Colorado, there is an additional benefit, which is called family. Works very similar to the federal program in that you can take off 12 weeks of absence. But in Colorado's situation, you can actually get paid. So current employees, as well as employers, pay into this family leave fund. And it went into effect January 1 of 24. So it's been in effect for about a year and a half. And every year there is an assessment by the state of Colorado where the employer and the employee pay into this fund. And then it works very much like Social Security, for example, where you pay in, and when you need to use the benefit, then you apply for it and you can get this paid leave of absence. Again, it can be done piecemeal, where you take 2 or 3 days off and you get paid, or it can be paid in the full 12-week block of time. You can get it annually. So every year you can reapply and get approved. There is an application process, and if people need help with that, feel free to call our office or go on the state's website and fill out the forms. I've known lots of people who have used this over the last year and a half, and everyone that has used it reports that they've been very satisfied because it gives you, the caregiver, an opportunity to really recharge. You're in a situation where you can get some rest and you're not trying to balance the care of a loved one as well as your job. So, you, as the older adult, really take, if you will, um, take charge and encourage your family caregivers, your grandkids, to take advantage of this. This is not available, neither of these programs are available to friends and neighbors, but they are available to immediate family. So it could be a spouse, it could be adult child, or son in law or daughter in law, or it can be like a grandchild. Um, Now, another thing that I want to talk about a little bit is, even though you, as an older adult, want to age in place, placement may be necessary. And no one wants to go to a facility, but sometimes that happens. So do not, and I beg you, as part of your advanced care planning, do not beg or make your family members promise that they will never put you in a facility. And the reason for that being is none of us can predict the future. But let me give you a couple of examples. So, I one time had to place an individual in a facility because She had a medical crisis. She ended up in the intensive care unit. They were able to bring her back with all of the technologies that they used. At one point, they thought that they were going to lose her, but her advanced directives said that she did not want to be, she wanted CPR until the very end. So when they performed CPR, her heart started again. She was able to be weaned off the respirator, but she had almost no use, if you will, of any of her ability to think, her ability to feed herself, or do any of those kinds of things. And had I promised her that I would never put her in a nursing home, not only would I have felt guilty, but she would have been very angry. Now, she was angry anyway with me, but I told her right up front, and I told her as we were going through the placement that I have a family. I cannot provide you 24-hour care, and the type of care that you need is beyond or over and above what any one person could ever provide on a 24-hour, 7-day a week basis. Fortunately or unfortunately, she was only in the assisted living for in the nursing home for about 3 months. And she did agree she had enough cognitive ability that she would go on hospice, and they were a great support. But do not make loved ones promise that they will never put you in those facilities. Because again, there are all these reasons that contribute to that decision. And if you make them promise that, all you will generate at the time that they are forced to make that decision and that placement is guilt. And that doesn't do anybody any good. It's going to be hard enough. And if they feel guilty, your caregiver, then they're only going to feel worse. So that brings our comments today regarding advanced care planning and how to provide support to the individual who is your caregiver. Just a few comments about a few services that the Colorado Gerontological Society provides. We do provide dental services, and if you are not receiving dental care through Medicaid or private insurance, we will have new money starting July 1. Feel free to apply. We still have our Telephone Buddy program, and this is a great program actually. As you become less able to take care of yourself, you could call our office and ask for a telephone buddy. The telephone buddy is somebody who calls you once or twice a week, usually for 10 or 15 minutes, but they're calling to be your friend, calling to just check in and make sure that you're okay. This is another way to provide support not only for yourself, but to support your caregiver as well. If you live in Denver County, we can also provide you with some mental health counseling. We currently do have openings. You can get about 10 sessions from a licensed clinician for mental health supports for things like grief, loss support, anxiety, those kinds of things. We have a small amount of money to provide grants for low vision aids. This is things like reading lamps and stuff like that. This session is part of our advanced care planning educational programs, but we can also help you with counseling around should you get a power of attorney, guardianships, those kinds of things. There are also a large number of videos that are on our YouTube channel. Feel free to take advantage of those. Our counseling and referral and public benefits counseling is one of the things that we have done for many, many years and is always available to anyone who needs to discuss a problem, come up with a plan, come up with ideas. Our housing and home care locator on our website can help you identify an assisted living or a nursing home, home care services, retirement community services, should you need that. And at the holiday time, we provide holiday baskets to 350 low income individuals who primarily will be alone for the holiday. And this is only in Metro Denver. We also provide the Salute to Seniors, which this year will be on August the 23rd in person, August the 24th virtually. The virtual one will be from 11:30 to 1. The in-person one will be at the Greek Event Center, and it will be from 9:30 to 3. We hope to have about 100 vendors, lots of food, different kinds of displays and events, including a classic car show by the Forney Museum. We'll have some musical bingo and a number of other things going on. We're still very active in both housing as well as public policy advocacy, trying to find ways to, again, make sure that services and resources are available for older adults, regardless of income. And then we do our consumer and professional training. And we also hope to distribute sometime in the next few months our senior resource guidebook, which again will be updated and available through libraries, or you can call and request a copy for a $15, I believe it's 15, it might be 10, postage and handling charge. And lastly, I want to just share with you, if you have not taken advantage of the senior housing income tax credit, we are currently working on an initiative. Watch the announcements, but the goal of this initiative is basically for people be directed at people who are non-income tax filers, those who make basically $25,000 or less. Will have to fill out a DR 0104 and a CR 104 to claim that, but you can get an $800 senior housing income tax credit, as well as the TABOR refund that has to be filed by October 15th, 2025. If you're even more low income, well, let me go back. If for the senior housing income tax credit, if your income is between 25,000 and 75,000, you will get a prorated amount. If you file income tax, it should be included in your income tax filing. If it is not, you can file amended form and claim the percentage or the prorated amount. If your income is less than 18,700, you may also be eligible, in addition to the senior housing income tax credit, you may be eligible for the PTC 104, and that gets you some help with your a refund on your rent or your property taxes. And so that's a little simpler form to file. And part of the initiative that we're going to be working on is there will be some locations throughout Colorado where you will be able to make an appointment with some volunteers. We are partnering with some senior health insurance agents um, who will be trained and be able to assist with filling out these forms. Additionally, if you need help with your health insurance, they can support you in that as well. So that closes up our remarks for today. Should you have any questions, I will be happy to take those at this time. So it looks like no one put any requests for questions in the chat. Does anyone have any questions that you would ask at this point in time? If so, take yourself off mute and I'll be happy to try to answer it. Well, thank you for joining us today, and I look forward to having you join us in the future for additional sessions.